Clinical reasoning and decision-making is an integral part of paramedicine as it sets the premise for an ongoing treatment plan. Ineffective clinical reasoning leads to diagnostic error and significant harm to the patient. In the pre-hospital environment, paramedics are required to make decisions in less than ideal circumstances with limited tests and procedures available to accurately diagnose. Therefore, the ability to reason and make decisions in the face of uncertainty is paramount and ultimately contributes to the safe and holistic care of patients. Some literature uses the concepts of clinical reasoning and clinical decision-making interchangeably. However, for the purpose of this reflection, as explained by Macaulay, Brodvig, Kadakia, and Bonville 2017, clinical reasoning is defined as assessing the cause of a situation and identifying available courses of action and the potential risks and benefits that these actions could have upon the patient. Whereas clinical decision-making is the selection of an appropriate course of action based on this assessment. The goal of clinical reasoning is accurate diagnosis and decision-making. The issue that presents for us as students is that many clinicians use intuition to reason and make clinical decisions. This is a skill we have not yet mastered as our expertise and experience is limited. Therefore, we are more prone to diagnostic and treatment errors. Throughout clinical placements, it has become apparent how reliant paramedics are on their own clinical experience, as I often witness my mentors walk into a scene and decide on a diagnosis and treatment plan almost effortlessly. This can be attributed to simply having more experience and confidence, or perhaps a prior knowledge of this particular presentation. Whereas as a student, I require a much more deliberate thought process and even still, in some instances, maintain a degree of uncertainty on the course of action to undertake. Knowing that effective and accurate clinical reasoning and decision-making requires experience and expertise is discouraging and does not instill confidence, as clinical placement is not enough experience to fully develop skills in this area. Therefore, as a future novice clinician, I will need to rely on the expertise of others to ensure I am making the correct decisions before I can develop my own expertise. Knowledge together with experience in varied situations is vitally important for the accurate diagnosis and treatment of patients. Throughout this degree, we have been given the opportunity to practice clinical reasoning and decision-making in both clinical simulations and through on-road experience. Through clinical simulation, we are provided with scenarios based on real-life situations that promote aspects involved in clinical reasoning and decision-making, such as critical thinking and problem-solving. However, a study conducted by Thompson and Stapley 2011 showed that interventions used by educators in developing clinical reasoning and decision-making often do not produce positive results, proving that experience and expertise are necessary in developing these skills, and no matter how much we are taught at university, we ultimately require clinical experience to effectively succeed as a paramedic in the future. Clinical reasoning is a complex process that is directly linked to safety and quality of care and involves multiple aspects. Communication is the main skill utilized in clinical reasoning in gaining objective and subjective data to aid in diagnosis and treatment. Communication skills have been continuously developed throughout the course of our paramedic degree and will continue to improve with additional clinical experience. Likewise, using and interpreting diagnostic tools is another key aspect that we have learned and can continually practice to assist in decision-making. Although these skills are entirely useful and necessary for clinical reasoning and decision-making, there are many aspects that cannot be taught at university and must rely on experience and expertise. As a result of this, we as students do not have the ability to generate hypotheses and explore these as early as experienced clinicians, and therefore we struggle to make timely decisions and develop an appropriate treatment plan for our patients. Clinical reasoning is the thought and decision-making process associated with good clinical practice. It involves identifying problems based on an understanding of the patient's situation, both medically and environmentally, and an ability to make decisions with the available information, including the patient's history and diagnostic findings. There are many models of clinical reasoning that assist clinicians in decision-making. However, the dual process theory is the superior method used. The dual process theory holds the notion that we use two systems to think, one being intuition or experience, and the other being analysis, which is a more thorough and deliberate way of reasoning. The idea of this theory is that we rely on both systems to make accurate clinical decisions. However, this becomes problematic in terms of novice clinicians due to a reliance on analytical thinking, an attribute that a student consequently develops due to the period of study. The decision-making process of an experienced clinician is fundamentally different to that of a student or a novice clinician. When considering the dual process theory, a novice clinician lacks the ability to rely on intuition or experience and will therefore have a slower and more ponderous approach to clinical reasoning and decision-making. As students and soon-to-be novice clinicians, we are more prone to making errors in decision-making, have a limited ability to recall learned information, and heavily rely on biomedical knowledge rather than clinical knowledge. The basis of the dual process theory is hypothetico-deductive reasoning, which involves methodical decision-making in stages and is the recommended process for novice clinicians. The 4 stages include gathering subjective and objective data, generating a hypothesis, interpreting the data, and evaluating the hypothesis. In using this theory, experienced clinicians tend to have a wider range of potential hypotheses due to their developed intuition and can extract further information using deductive reasoning more accurately than a novice clinician. A novice clinician will tend to generate hypotheses and then rely exclusively on analysis rather than intuition to rule them in or out, thus taking longer to reason and make decisions. A study conducted by Wainwright, Shepard, Harmon, and Stevens 2011 explored the differences between novice clinicians and experienced clinicians and found that both novice and experienced clinicians often arrived at the same decision, however the thought processes used were different. Novice clinicians relied on informative factors, whereas experienced clinicians used directive factors. As students and novice clinicians have limited experiential knowledge, we are challenged with making effective decisions and often maintain a high degree of uncertainty and a lack of confidence in our ability to diagnose and implement an effective treatment plan for the patient. Regardless of the reasoning process, many variables affect the outcome of clinical reasoning. These include cognitive ability, life experience, maturity, skill level within clinical practice, information available, risks involved, level of uncertainty, and confidence in one's ability and expertise. The academic experience I have gained throughout this degree has provided me with important skills needed for clinical reasoning, such as history taking and physical examination. However, academic experience alone does not constitute good clinical reasoning and decision-making ability. Academic experience must be coupled with clinical experience, and this is where students and novice clinicians fall short. A lack of clinical experience results in higher chances of misdiagnosis and incorrect treatment plans, which may be detrimental to the patient. In understanding the concepts of clinical reasoning and decision-making and the challenges faced by students and novice clinicians, I am now better equipped to enhance my reasoning and decision-making skills for my future practice. There are various ways to develop these skills and become a more experienced clinician by building on existing knowledge. The process of clinical reasoning and decision-making involves critical thinking, reflective practice, problem-solving, judgment, ethical values, professional accountability, and scientific evidence-based practice. Evidence suggests that clinicians develop their expertise through experiential learning, by observing the reasoning of experts, practicing self-reflection, and building on their knowledge bank. Upon reflection of this topic, observing mentors and how they reason and make decisions will allow me to adopt similar strategies to assist in my own clinical reasoning and decision-making. This is proven to be an effective way of developing skills. However, observation must be coupled with reflection in order to reap benefits. Reflection is used by clinicians to solve problems and gain specific knowledge. Reflection in action assists in understanding the issue at the time, and reflection on action assists in learning from the encounter and growing in experience. Through self-reflection, I will be able to move from decision-making through guiding principles to making decisions based on experience through rapid analytic processes. In developing my skills in critical thinking, problem-solving, reflective practice, and scientific evidence-based practice, I will be able to enhance my clinical reasoning and clinical decision-making abilities, which will ultimately make me a more experienced and safer clinician in the future.